Good morning, Madam Christina and fellow friends. My name is Li Shihang with the metric number of 278841. Today, our topic discussion is medicine and health. Medicine and health encompasses the study of prevention, cure, and understanding of disease, as well as the investigation of physical and mental well-being. The topic we are going to talk about is dengue fever. Dengue fever is a mosquito-borne tropical disease caused by the dengue virus. Dengue viruses are spread to people through the bite of an infected Aedes species mosquito. Dengue is common in more than 100 countries around the world. 40% of the world population, about 3 billion people, live in areas with a risk of dengue. Dengue is often a leading cause of illness in areas with risk. The reason we would like to discuss about dengue fever is the number of dengue cases reported to World Health Organization (WHO) rocketing over the last 2 decades, from 500,000 cases in year 2000 to over 2.4 million in 2010 and 4.2 million in 2019. Reported death between year 2000 and 2015 increased from 960 to 4,032. Here are some key facts about dengue fever. For people who get sick with dengue, symptoms can be mild or severe. Severe dengue can be life-threatening within a few hours and often requires care at a hospital. The mild symptom of dengue can be confused with other illnesses that cause fever, itches, and pains. The most common symptom of dengue is fever with any of the following: nausea, vomiting, rash, itches and pain, especially on eye pain, eyes, muscle joint, or bone pain. Symptoms of dengue typically last 2 to 7 days. Most people will recover after about a week. So you may be curious about ways to diagnose dengue fever. To diagnose dengue fever, doctors use blood tests to check for viral antibodies or the presence of infection. If you experience dengue symptoms after traveling outside the country, you should see a healthcare provider to check if you are infected. For treatment of dengue fever, there is no specific medicine to treat dengue. You may use paracetamol to reduce your fever, headache, and joint pain. However, please take note that aspirin and ibuprofen can cause more bleeding and should be avoided. You are also advised to rest as much as possible, drink plenty of fluids to stay hydrated, drink water or drinks with added electrolytes, and see a healthcare provider if you develop a fever or have symptoms of dengue. I will now talk about severe dengue. Severe dengue can result in short internal bleeding and even death. If you have had dengue in the past, you are more likely to develop severe dengue. Infants and pregnant women are at higher risk for developing severe dengue. The symptoms of severe dengue is belly pain, tenderness, vomiting at least 3 times in 24 hours, bleeding from the nose or gums, vomiting blood or blood in stool, feeling tired, restless, or irritable. If you have any warning signs, see a healthcare provider or go to the emergency room immediately. Severe dengue is a medical emergency. It requires immediate medical care at a clinic or hospital. So, how to prevent dengue fever? As we all know that there is no vaccine to prevent dengue fever. The best method of protection is to avoid mosquito bites and to reduce the mosquito population. When in a high risk area, you should avoid heavily populated residential areas. You should also use mosquito repellent indoors and outdoors. Wear long sleeve shirts and pants tucked into socks. Use air conditioning instead of opening windows. Ensure that window and door screens are secure and any holes are repaired. Use mosquito net if sleeping areas are not screened. Reducing the mosquito population involves getting rid of mosquito breeding areas. These areas include any place that still water can collect, such as bird bath, pet dishes, empty planters, flower pots, cans, and any empty vessel. This area should be checked, emptied, or changed regularly. That's all I would like to talk about dengue fever. Thank you.
Hi and Assalamualaikum warahmatullahi wabarakatuh to Madam Christina and my fellow friends. My name is Nuruzulaika Farzana binti Abu Hassan. My metro number is 279468. First of all, I would say thank you for watching this video. Me and my friends will talk about awareness of dengue fever. So, do you have been experienced on being a dengue fever patient or being a suspected of dengue patient, suspected of dengue fever? To be honest, I already experienced on being a dengue fever patient. In 2014, on that time I'm 14 years old, I have been admitted to hospital and already confirmed that I have a dengue fever. So when then I know that I have a dengue fever, I have a symptom of the sign to dengue fever, which is I always headache, I always being pain in my behind eyes, and then I have a difficult breathing. When I know that I have a difficult breathing, I thought that I have asthma, but no. And then another sign and another symptom is I have bleeding come out from the nose, and the worst part is I have bleeding in my urine. That was the worst part and really pain. So, do you want to know about the fact of dengue? So let's watch. So, what is dengue fever? Dengue fever is a dangerous disease that caused by dengue virus infection, which is genus Flavivirus Aedes female mosquito. This disease is very dangerous because it can make a person seriously ill, fatal, or die. The Malaysian Research Institution has been reported that dengue fever is an epidemic in a blood study conducted in 1953. There are two more severe types of dengue, which is namely dengue hemorrhagic fever and dengue shock syndrome. Now, I will talk about mosquito life cycle. Female mosquito play an important role in laying eggs to increasing the population of mosquito. Anopheles mosquito and Aedes mosquito laying their eggs at dust. Female mosquito eggs are oval in a shape. Female mosquito eggs also lay their eggs in water-rich areas such as ponds, wells, flower pots, and so on. After 2 to 3 days, it becomes an egg. It will turn to a larva. After larva, will turn to pupa. The shelf life of pupa is 3 days before it turning to become an adult mosquitoes. Now, I will talk about nutrition terms of mosquito. In the term of mosquito, male mosquito will consume fluids from plants such as honey from a flower, while female mosquito will consume fluids from plants and also can eat blood from human to produce their eggs. Female mosquito can suck the blood from human more than 1.8 times more than their body weight. There are two factors of dengue fever. The main factor of dengue fever is neglect of cleanliness surrounding areas. As I mentioned before this, that Aedes mosquito needs watery areas such as the standard water and or non-flowing water to breed their eggs. Untreated drains, flower pot, and old tire can be ground for mosquito to breeding. The second factor of dengue fever is neglect of hygiene and no self-discipline. Aedes mosquito are particularly fond of bushes and often roam around bushes between evening until dusk. Individuals who are often to return home late are at high risk in contracting dengue virus and can have a dengue fever. So now I will talk about how to avoid dengue fever. First of all, we can use system surveillance. Among the initial control and prevention measures taken by the government is the system surveillance, or better known as a monitoring system. Monitoring system should be done carefully. Monitoring system that needs to be done is to monitoring adult larva and the adult mosquito. Surveillance of this larva should be done in every residential premises as well as construction sites, especially settlements that are detected to have dengue outbreaks. So the second ways to avoid dengue fever is using the chemical materials. The chemical materials that used to control mosquito and larva is permethrin EC 2000 liter, permethrin EW 10,000 liter, and malathion TG 15,000 liter. The material use the method of spraying or liquid in areas where have the breeding of mosquito and larva. This technique will stop the breeding of mosquito and larva, so there are no egg and mosquito in that areas.